Tori, prepared family nurse practitioner, and I'm going to talk to you about hypertension and kidney disease. Hypertension is a blood pressure of 140 over 90 or greater. The ideal blood pressure will be 120 over 80. And hypertension can lead to kidney disease. 1 in 7 Americans are affected by kidney disease. That's 35 million people. African Americans are 35% more likely to have kidney disease than other people. And some things you can do to monitor and watch hypertension: regular blood pressure checks. The DASH diet is the dietary approach to stop hypertension. Annual checkups where you get lab work that would include a creatinine, BUN, and an estimated glomerular filtration rate. That will tell the health of your kidneys. Some things you can look for at home would be a tea-colored urine, fatigue, swelling, headaches. Those can all be signs of untreated hypertension or kidney disease. 90% of Americans don't even know they have kidney disease. Please know your numbers and be screened. Thank you.
RSV. Respiratory syncytial virus, or RSV, is a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be serious. Infants and older adults are more likely to develop severe RSV and need hospitalization. If you are age 60 or older, a vaccine is available to protect you from severe RSV. Talk to your healthcare provider to see if it's right for you. If you are pregnant, you can get an RSV vaccine between 32 and 36 weeks of pregnancy to protect your infant after birth, or a preventive antibody can be given to your baby after birth. People infected with RSV usually show symptoms within 4 to 6 days after getting infected. Symptoms of RSV infection usually include runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. These symptoms usually appear in stages and not at all at once. In very young infants with RSV, the only symptoms may be irritability, decreased activity, and breathing difficulties. Almost all children will have had an RSV infection by their second birthday. Call your healthcare professional if you or your child is having difficulty breathing, not drinking enough fluids, or experiencing worsening symptoms. RSV can spread when an infected person coughs or sneezes, virus droplets from a cough or sneeze in your eyes, nose, or mouth. You have direct contact with the virus, like kissing the face of a child with RSV. You touch a surface that has the virus on it, like a doorknob, and then touch your face before washing your hands. People are typically infected with RSV for the first time as an infant or toddler, and nearly all children are infected before their second birthday. However, repeat infections may occur throughout life, and people of any age can be infected. Infants, young children, and older adults are at increased risk of severe RSV. People infected with RSV are usually contagious for 3 to 8 days and may become contagious a day or two before they start showing signs of illness. However, some infants and people with weakened immune systems can continue to spread the virus even after they stop showing symptoms for as long as 4 weeks. Children are often exposed to and infected with RSV outside the home, such as in school or child care centers. They can then transmit the virus to other members of the family. RSV can survive for many hours on hard surfaces such as tables and crib rails. It typically lives on soft surfaces such as tissue and hands for a shorter amount of time. In most regions of the United States and other areas with similar climates, RSV season usually or generally starts during fall and peaks in the winter. The timing and severity of RSV season in a given community can vary from year to year. How to protect yourself and others. Healthcare providers are encouraged to administer Nurisavab to protect infants against severe RSV. They are encouraged not to save doses for later in the season. Neither Pfizer or Arexvy vaccines are recommended for use in young children. For healthcare settings with limited supply, learn about prioritizing doses. RSV immunizations are recommended only for these groups: adult ages 60 and older. There are 2 RSV vaccines that have been licensed by the FDA and recommended by CDC for adult ages 60 and older using shared clinical decision making. Older adults are at greater risk than young adults for serious complications from RSV because their immune systems weaken with age. Pregnant women. There's 1 RSV vaccine by Pfizer, and it's been licensed and recommended during weeks 32 through 36 of pregnancy to protect infants. This vaccine is recommended during September through January for most of the United States because RSV is typically a fall-winter virus. Infants and some young children. An RSV preventive antibody has been licensed and recommended for infants and some young children. There are 2 ways to protect your baby from getting very sick with RSV. One is an RSV vaccine given during pregnancy. The other, immunization that provides antibodies to your baby after birth. And 2, getting an RSV antibody immunization for your baby if they're younger than 8 months and born during or entering their first RSV season. Everyday preventive measures to limit the spread of RSV is as follows. Stay home when you're sick. Cover your coughs and sneezes with a tissue or your shirt sleeve, not your hands. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your face with unwashed hands. Avoid close contact with others, such as kissing, shaking hands, and sharing cups and eating utensils. Clean, frequently touched surfaces such as doorknobs and mobile devices. Thank you.
Hi, my name is Chantel Jacobs. I am a licensed professional counselor and also the founder and owner of Pure Mind Counseling and Wellness. I'm here to talk to you about depression. Depression is a very common medical condition that affects the lives of so many people. It has a negative impact on how people think, feel, and also respond to the world around them. Some symptoms may include persistent feelings of sadness, isolation from others, withdrawing from activities that a person once enjoyed, excessive crying, changes in appetite or weight gain, lack of motivation or energy. And so as we highlighted some of those symptoms, it's also important to talk about what does it feel like? People often equate it to feeling numb, allowing one's thoughts to control you versus you control how you think. Or feeling exhausted to the point where you're constantly using sleep as just a way to escape from dealing with life's problems. There can be many variables that may cause depression, and some of those could be due to genetics. You may have a family history, trauma, abuse, grief and loss, even major changes in life events like depression. Depression can be treatable. So what does that mean? That means that there is hope for things to get better. But we just have to utilize resources and utilize coping skills as well. And so I'm going to briefly touch on what are some coping strategies that we can use. It can be reading a book or listening to a positive podcast, engaging in outdoor activities or hobbies, exercising, deep breathing. Also finding someone that you can talk to that you can trust, or even trying therapy where you can talk to a professional in a non-judgmental environment. If you or someone you know have feelings of self-harm, there's a resource where you can call or text 988 at any time of day and get the support you need. So I encourage everyone this week and next week and moving forward, begin to take better care of yourself. Find activities that you can do that can encourage you along life's journey.
Hello, my name is Dr. Garland Green, and I'm an interventional cardiologist here in Baton Rouge, and I work for Cardiovascular Institute of the South. It is my pleasure to work with the Baton Rouge Free Clinic that aids the members of this community in providing free health care to those who need it. I'm going to be honored to work with the Free Clinic again this year, and my focus today of our discussion is hypertension. Hypertension, or as is commonly known, high blood pressure, affects millions of Americans each year. It is one of the leading causes of morbidity and mortality that we see. However, it's often not paid attention to as much because it's not felt until you have very deleterious outcomes. And those outcomes can be things like stroke, heart attack, kidney failure, amputations, things that none of us really want to experience. It is so important that if you get diagnosed with hypertension, that you make a special effort to control your blood pressure. That will include things like, first of all, knowing your numbers. Know what normal blood pressure is and what it should be. Check your blood pressure routinely. Make sure you follow with your physician as often as necessary to keep that blood pressure controlled. You need to take your medications as prescribed. And also, you can help yourself by reducing the sodium intake in your diet and also getting regular exercise. Remember, hypertension is a very dangerous disease that can sneak up on you, and it's known as the silent killer because that's what it does. It's doing damage to you on the inside that you can't always see until you get those horrible symptoms that I spoke about earlier. Remember, having a headache alone or something like that is not necessarily indicative of high blood pressure. You get much more significant symptoms like the ones I described earlier. So please take this disease very seriously and make sure that you know your numbers, follow up with your physician, and take your medications. Thank you for your attention.
Hello and welcome to Love Heals the Boot. I am Dr. Ronald Andrews. I'm a board certified physician here in Louisiana, practicing both internal medicine and pediatrics. And today, while you're waiting, they've asked me to discuss diabetes and how important it is that we're aware of diabetes if we are already being treated or if we're unaware of some of the signs and symptoms that may identify that we are diabetic or becoming diabetic. It is unfortunate that they estimate 1 in 4 people have diabetes and are not even aware of it. And that is not included in the millions of people who have diabetes already. And it's estimated that that number will continue to grow each and every decade. So we definitely need to stem the tide. And I want to offer you some simple solutions of how we can do that. Number one, diabetes, just put simply, is your body's inability to process sugar. So it's not just white granular sugar that you might put in a dessert or put in some iced tea or lemonade, but carbohydrates in general, which convert to sugar inside your body. I always mention the simple carbohydrates that some people don't think about, but it's like the breads, the pastas, the rice, croutons on your salad. But that does not mean it's not the sugar that you put in your coffee, tea, and Kool-Aid type sugary drinks, but also candy, hard candy, peppermints, but also chocolate candies, cakes, pies, and donuts and other sweet desserts. If you have diabetes or you're developing diabetes, your body is not able to metabolize that sugar. And what happens is it starts coating your blood vessels, your nerves, in your brain, your eyes, your heart, all the way down to your fingers and toes, and it can cause a multitude of problems. There are multiple medicines for diabetes, but obviously diet and exercise, and if weight loss is needed, are the first lines of treatment. But they also have pills and injections, and I know everyone is talking about Ozempic now because Ozempic treats diabetes, but you also lose a lot of weight. I think that is a great choice for many if they have diabetes, but there are other treatment regimens that go with Ozempic: diet, exercise, a host of metformin, and so many other medications that we treat diabetes with to get the most comprehensive plan for you. So please get checked for diabetes today if you can, and then let's get you a treatment plan if necessary. Thank you.
Hello, Louisiana. A heartfelt thank you from Love Heals the Boot. Your collective efforts have transformed this initiative into a beacon of compassion and care. To our dedicated volunteers and healthcare professionals, your commitment to providing free medical services has not only healed bodies, but also touched the spirits of those in our community. Your kindness has created a ripple effect of positivity. To our cherished attendees, your trust and openness have made Love Heals the Booth a safe place for healing. Remember, your well-being is our mission, and we are grateful for the opportunity to serve you. As we look back on the moments of connection and support, we see the profound impact that love can have on health. Your involvement has been the key ingredient to our success, and we are profoundly thankful. Thank you, Louisiana, for being the heart and soul of Love Heals the Booth. Together, let's continue this journey of healing, because love truly has the power to heal. Your presence and support has made all the difference. Thank you, thank you, thank you.